Hello everyone, my name is Jennifer and we're going to talk about the importance of nursing history today. I chose to read the book Order to Care, The Dilemma of American Nursing from the year 1850 to 1945 by Susan M. Riverby. A little bit about the book. Nursing started as skills passed on from mother to daughter. Women were first called to nursing by caring for their families and loved ones. Riverby explains how the role of the caretaker develops into profession and evolves into nursing as we know it. But with the expansion of caretaker comes consequences and the need for structure. With the profession of nursing growing came nursing leaders and nursing policy. However, even though nursing became a structuralized profession, it was still stigmatized as women's work, creating inequalities, some of which nurses still face today. Next, looking at nursing as an explanation. Nursing as an explanation ensures we do not overlook something or look at it in isolation. Studying nursing from a historical aspect gives us a new light into the nursing world. As explained in the book, nursing was classified as women's work and came with less respect. Physicians did not want to be bothered with meddling women. Riverby quotes, "Nurses are helpers and agents of physicians, not co-workers or colleagues." Gender roles are still an issue that nurses face today. However, nursing has come a long way since then. We now have female administrators, physicians, and male nurses. Since the pandemic, the nursing profession has gotten so much praise and honor. Nurses are seeing higher patient acuity and more responsibility at the bedside. And with more responsibility comes the need for more education. Next, looking at history as a pedagogy, Nelson states that history is more than learning events and great achievements. It's about learning from our past and mistakes. Using nursing history as a pedagogy shapes our identity as nurses and the way we think. A pedagogy is the art or science of teaching. For nurses, education began in the hospitals. However, there was little to no emphasis on education, and nurses who were training there were just treated as another hospital worker. As a profession, nursing is evolving, and we must use our history as a teaching point or pedagogy so history does not repeat itself. Lastly, history as evidence. History as evidence provides details as witness to past events. The knowledge and evidence gives a voice to those of the past and sometimes dispels myths. Studying the past removes assumptions and allows us to experience the past through details and the evidence. Some issues that are described in the book are still found in hospitals today. For example, nurse-to-patient ratios. The nurse-to-patient ratios are primarily left up to the organization to define when hospital administrators have been away from the bedside for some time. Next, long hours. Nurses have a caring background and often are guilted into staying over or picking up an extra shift. Knowing these issues are still prevalent for our nurses today gives blossoming nurses the initiative to have a voice and to speak up and speak louder so we are heard. Thank you for listening.